Hello, my name is Tim Byers. I'm a professor of epidemiology at the Colorado School of Public Health, and I've been working throughout my career in cancer prevention. What's happened over the past 25 years in the United States is remarkable. For the first time in history, cancer death rates are on the decline. And for many cancer sites, that decline has really been substantial. Let's take a look at what's happened in cancer over the past 25 years in the U.S. and comment a bit on what we know and what we don't know about the reasons. And most importantly, what lessons have we learned in the past 25 years about how to prevent cancer and better treat it and better control it that we can apply towards the future. First, let's start with lung cancer. Far and away, more people die of lung cancer here in the United States than from any other cancer site, and that's true for both men and women. In fact, there's more deaths from lung cancer than breast cancer, colorectal cancer, and prostate cancer combined. So in 1990, the death rates from lung cancer for men in the US peaked, and they've been declining ever since. Death rates didn't peak for women until about 10 years ago, and now they are also on the decline. Now, the reasons for these trends in lung cancer death rates are not at all mysterious. They follow, predictably, the trends in tobacco use by men and women. Since 1990, the decline in lung cancer death rates for men in the United States has been 45%, and that's remarkable. Now, the risk of dying from lung cancer among women has always been and continues to be substantially lower than men because of differences in the history of tobacco use among women. In fact, with the whole promotion of tobacco for women in the 1980s and 1990s, the whole Virginia Slims thing, the decline in use of tobacco by women lagged that of men. But beginning in about the early 2000s, lung cancer death rates peaked among women, and they're now, fortunately, also on the decline. If we look back at the past 25 years, I think one of the important lessons for us in the United States is that this state-to-state variation that we now see in both smoking rates and lung cancer death rates is really a sad testament to the variation in emphasis of tobacco control across the states. One of the challenges moving forward for us as a country, I think, is how to either nationalize or somehow better standardize our approach to tobacco control across the states. For colon cancer, we know there are many factors that lead to getting the disease, and there are many ways to both prevent the disease and diagnose it earlier. Over the past 25 years, there's been about a 45% decline in death rates from colon cancer in the United States. We've seen this in both men and women, and I think this is due to, in large part, to the progress that we've made in screening and finding the precursor lesions for colorectal cancer, adenomatous polyps. So there's no reason to believe, I think, as we look to the future, that colon cancer death rates will not continue to decrease. I think they will continue to decrease as a result of the continuing progress we're making in colorectal cancer screening and with ambitious goals such as the 80 by 18 goal, which is setting out for the country the goal of having 80% of adults properly screened for colorectal cancer by the year 2018. Since 1990, there's been almost a 40% decrease in the risk of dying from breast cancer. About half of that decrease is due to screening and early detection with mammography, and the other half is due to improved treatments, especially for those breast cancers that respond to hormonal stimulation, the estrogen receptor positive breast cancers. As we look to the future, I think one of the challenges is to continue to keep mammographic screening rates high as we continue to make progress in breast cancer treatment. For prostate cancer, we have quite an incomplete understanding at this point as to what causes this disease and how we might be able to effectively screen for it early. Nonetheless, since 1990, there's been about a 50% decrease in death rates from prostate cancer in the United States. Much of this decrease is due to improved treatments, especially more early in the process of the natural history of prostate cancer using anti-androgen treatments. One of the big controversies in prostate cancer is PSA screening, and the question as to how much, if any, of this death rate decline is due to PSA screening is still very much up in the air. But there's been substantial progress in prostate cancer, and if we can answer questions about screening and continue to make further improvements in treatment, there's no reason that this 50% decline in prostate cancer mortality can't continue into the future. So for the four leading causes of cancer, lung cancer, colorectal cancer, prostate cancer, and breast cancer, we've seen between 40 and 50% declines in death rates just in the last 25 years. But for many of the other cancers, we have not made progress. And in fact, death rates are increasing for some other cancers, in particular pancreas cancer and liver cancer, for which we both have an incomplete understanding of their causes, and we've not yet developed early detection or effective treatment methods. For some cancers, though, there's reason to believe that progress will be substantial in the future. Take, for example, cervical cancer. Cervical cancer death rates have been on the decline for the past century in the United States because of effective early detection and early treatment of premalignant lesions from Pap smears. Now that we have an effective vaccine for the virus that causes cervical cancer, the human papillomavirus, there's no reason to believe that this cancer can't become exceedingly rare in the future as we get better vaccination coverage to young girls and boys in the United States. So if we sum up this progress that we've made in cancer since 1990, we see that over all cancer sites, including the lung and colorectal and breast and prostate sites for which we've made substantial progress, and all the others for which we've made less progress, there's been about a 26% decline in the risk of dying from cancer in the United States. I think never again will we see cancer death rates in this country as high as they were in 1990. So this is a historical shift, and I think with increasing understanding of how we can prevent cancer from occurring in the first place, how we can detect it more effectively and earlier, and importantly, how we can develop better, more effective treatments, there's no reason that this slope of decline can't even steepen into the future. In 1990, the American Cancer Society set a very ambitious goal for the nation to reduce death rates from cancer by 50% between the year 1990 and 2015. So we achieved a little over half of that goal. But the knowledge that we now have, I think, can shift what used to be a fatalism about cancer into an optimism. Let's figure out better what prevents cancer, how we can detect it early, how we can treat it more effectively, and most importantly, how we can use the knowledge that we already have across states and across healthcare systems and across communities to further drive cancer down into the future.